Welcome to the Biomedics 510K submission series, your guide to navigating each step of the FDA process with confidence using eSTAR. This content is educational and not a substitute for regulatory or legal advice. Always consult FDA guidance and a qualified expert for your device strategy.
Welcome back to our 510K submission series. In this video, we'll explore two interconnected pillars of medical device development and regulatory compliance: risk management and quality management system, QMS, integration. While your QMS is your company's overarching framework, a fully integrated risk management process, primarily guided by ISO 14971, is what truly underpins the safety and effectiveness claims in your 510K submission. The FDA's eSTAR platform heavily relies on your diligent application of risk management principles. It's not enough to simply have a risk file. Your eSTAR submission must demonstrate how risk has been identified, analyzed, controlled, and reviewed throughout your device's design and development. What is risk management? At its core, risk management in medical devices is a systematic process for identifying, analyzing, evaluating, controlling, and monitoring risks associated with the use of a medical device. Its ultimate goal is to ensure that the benefits of using your device outweigh the residual risks and that these risks are acceptable. The international standard that guides this process is ISO 14971, Application of Risk Management to Medical Devices. This standard outlines a comprehensive framework, and adhering to it is a fundamental expectation for regulatory submissions globally, including FDA 510Ks. The risk management process. Key elements. A risk management process, as defined by ISO 14971, involves several key steps. Risk analysis. This includes hazard identification, where you systematically identify potential sources of harm, hazards related to your device, and risk estimation, where for each hazard, you estimate the probability of occurrence and the severity of potential harm. Risk evaluation. Here, you determine whether the estimated risks are acceptable based on your company's predefined risk acceptability criteria. Risk control. This involves implementing measures to reduce risks to an acceptable level. ISO 14971 prioritizes controls in this order: inherent safety by design, protective measures, and information for safety. Evaluation of overall residual risk. After implementing controls, you evaluate the remaining residual risks to ensure the overall risk profile is acceptable. Risk management review. You periodically review the risk management file to ensure its continued effectiveness throughout the device lifecycle. Risk management files for eSTAR. Your complete risk management file, RMF, is a living document that captures all these activities. For your eSTAR submission, you generally won't input the entire RMF directly into eSTAR, but rather provide a comprehensive summary and upload the full, detailed RMF as an attachment. eSTAR has a dedicated risk management module. Within this module, you will typically find fields and prompts for a risk management plan, summary, a risk analysis summary, a risk controls summary, an overall residual risk evaluation summary, post-production information, and upload of the full risk management file. Quality management system, QMS, integration. Your risk management activities are an integral part of your company's broader QMS. The QMS governs how your device is designed, manufactured, distributed, and maintained. For medical devices, the primary standards are ISO 13485 and the FDA's Quality System Regulation, 21 CFR Part 820. eSTAR does not contain your QMS, but it demands evidence of its effectiveness. Throughout your eSTAR submission, various sections require information that directly reflects your QMS processes, especially your design controls. Key areas where your QMS is evidenced in eSTAR are device description, design inputs, performance testing, design verification and validation, software documentation, design control for software, labeling, design outputs and risk controls, and sterilization and shelf life, design control outputs. eSTAR enforces consistency. Completing the risk management module implicitly demonstrates that your QMS includes risk management procedures per 21 CFR 820.30G. Common pitfalls in risk management and QMS for submissions. Common pitfalls include submitting a generic RMF not specific to the device, lack of traceability between risks, controls, and design testing data, undefined or unjustified risk acceptability criteria, over-reliance on labeling rather than design or protective controls, and failure to include a post-production risk monitoring plan. In conclusion, a thorough ISO 14971 compliant risk management process, fully integrated with your QMS, is fundamental to a successful 510(k). eSTAR provides a structured framework to present this data clearly. Demonstrating systematic risk management from concept to market builds reviewer confidence and supports clearance. In our next video, we'll dive into FDA Foundation docs and the 510(k) summary or statement. See you then.
Thanks for watching our 510(k) submission series, your step-by-step guide to navigating the FDA process with confidence using eSTAR. This content is educational and not a substitute for regulatory or legal advice. Always consult FDA guidance and a qualified expert for your device strategy.